Hi, I'm Krista Davis, and I'm the External Relations Officer at Project Concern International. PCI is a global development organization whose mission is to empower people to enhance health, end hunger, and overcome hardship. Today is November 17th, which is World Prematurity Day, and I'm here with PCI's Senior Director for USAID-funded Every Preemie Scale project, Judith Robb-McCord.
Hi, good morning, Krista. Thank you so much for helping us celebrate World Prematurity Day.
And thank you for being here with me.
Pleasure.
So tell me, why is it important that we draw attention to preterm birth today?
So as you know, newborns in general are very vulnerable. But every year, 15 million babies are born too early, which is basically defined as before 37 weeks of gestation. So that's actually 1 in 10 babies born worldwide every year who are too early, which makes them very small and very vulnerable. And so right now, because of that, because of their vulnerability, and because of the large numbers of babies that are being born early, complications related to preterm birth has become the #1 cause of deaths among children under 5 globally. So it's a very, very significant public health issue.
Wow, the #1 cause of deaths for children under 5.
That's right, yes.
That's a huge statistic.
That's right.
Wow, so what are some of the causes of preterm birth? Why is this happening?
So preterm birth can actually happen very spontaneously. It can also happen because of elective C-sections, early induced labor and delivery. But there are also a whole range of issues that are related to preterm birth that cut across a woman's reproductive health lifetime. And so there are a number of risk factors that are associated with her prior to pregnancy, during pregnancy, and even after pregnancy. So adolescent pregnancy is a huge problem. Alcohol and substance abuse, sadly, has a very negative impact on fetal growth and development. There are other issues like births that are too closely spaced, and so women needing family planning so they're actually able to safely space their births. A number of other things, domestic violence, and then some kind of chronic conditions like hypertension, for example, or diabetes can also be a problem for women in terms of their elevated risk for preterm birth.
How does the United States compare to other areas of the world when it comes to preterm birth statistics?
So that's actually a very interesting question. I think a number of people don't realize how significant it is in this country. So right now, 60% of preterm births actually occur in Africa and in South Asia, and Nigeria, Pakistan, and India contribute a significant proportion of all preterm births worldwide. Interestingly, however, the United States is actually #6 as a global contributor to preterm birth. So we're sandwiched right between the Democratic Republic of the Congo, a very low resource country, and Bangladesh, which is also a middle to low resource country. And so the United States is actually #6. So it's a significant contributor to the global burden of disease for preterm birth.
Wow, that's fascinating that the U.S. is one of the top countries. I'm curious though, how does the survival and care of preterm babies compare in the U.S. to other areas in the world?
So a baby who's born early in the United States is much more likely to survive than a baby who was born in a low resource setting. So whereas where you have extremely preterm newborns, the success rates for survival in the United States and European countries is very high. 90% of those babies will survive. Whereas only 10% of those babies born in a country such as Ethiopia, for example, only 10% of those babies will survive. So there are huge disparities in health systems, access to health care and resources that really impact the survival of these small babies.
So when you're talking about the survival, I've heard you say before preterm babies surviving and thriving.
Right.
Can you tell me more about what that means?
So in the world of care for a preterm baby, there are a number of things that can happen. Most preterm babies, I think it's important to note, that most preterm babies, 32 to 37 weeks, can actually survive and thrive with very basic care. So they get, immediate, essential newborn care, warming, drying, support for breastfeeding, skin-to-skin contact, and support for any kind of respiratory distress. And then there are other babies who will need more specialized care, more advanced care. But the whole Thrive piece is just really ensuring that these babies get the care that they need when they need it. So essential care and more advanced care, so that you're dealing with some of the complications and hopefully lessening the impact of some of the complications. Lots of preterm babies will go on to have certain disabilities and chronic conditions throughout their lifetime. But there's a lot that can be done very early on to lessen the negative impact of those complications and to ensure that these babies thrive going forward.
So not just ensuring that they survive, but that they live really healthy,
That's right.
holistic, healthy lives.
That's right. That's right. And I have to emphasize as well that breastfeeding support, I don't know that I've said nearly enough about human milk feeding and breastfeeding support and how critical that is to these babies in terms of their ability to gain the weight that they need to gain so that they are less vulnerable over time. And also the importance of making sure that the care they're receiving in a facility, if they do need more specialized or more advanced care, that that care is very safe. There's a number of interventions that can be used, that are used for preterm babies and other sick babies, that can actually, if not managed correctly, can actually cause quite a bit of harm. So it's very important, again, in that thrive, the survive and thrive equation in terms of a baby's outcome, that we make sure that this inpatient newborn care is very well managed, very safe, and very high quality.
Can you tell me a little bit more about, I'm talking a lot about the hospital part, but what about when the babies come home? What can be done more there to help babies survive and thrive?
So it's really important that when a mom and other family members are actually in a facility, so for example, if a mother is in a kangaroo mother care unit at a facility where she's practicing skin-to-skin care, she's being supported for breastfeeding or to provide the baby breast milk, the baby is being protected from infection. So a lot happens in that kangaroo mother care unit. A lot happens, as we know, in the neonatal intensive care unit, for example. But when those families are going home, they're often hugely intimidated. They're taking home a very small baby. The baby is often still quite small, and there are certain vulnerabilities. But if we can work with families, and mothers particularly, so that they have full access to their babies, especially during NICU and more advanced care, and that providers work with them to understand managing the care for the baby over time and ensuring that mothers and families will bring those babies back for their follow-up care. That is very important. Babies can go home and they can quickly drop off in terms of their vulnerability. Maybe they start losing weight again, they're exposed to new risk factors such as infection, all sorts of things. And so it's really important that these babies that families are empowered so that when they take the baby home, they know how to recognize danger signs, they know how to continue to care for the baby, the mother feels confident in her breastfeeding, and that they then recognize when it's time to go back to the facility for very important follow-up care.
So it sounds like a very holistic approach.
Right.
The education, the resources and tools, and the interventions.
Exactly, that's right. And I think it's important what you have highlighted is this household to hospital continuum of care, that we need to get women to deliver in facilities that can actually manage labor and delivery safely and can manage these early small babies immediately and over the long term. And that once moms and babies go home, that they, again, are empowered to manage that care, and then they get support for the very important follow-up care.
Tell me more about your project, Every Preemie Scale, and how you're engaged in this global effort.
So, as you mentioned earlier, Every Preemie Scale is funded by the U.S. Agency for International Development here in Washington, D.C. And we are working, PCI, with two other partners, the Global Alliance to Prevent Prematurity and Stillbirth and the American College of Nurse Midwives. And we have been working over the last 3 years. We've just entered our 4th year of programming, and we've been working over the last 3 years with a range of global partners, the UNICEF, WHO, non-governmental implementing partners, as well as governments and professional associations, to really continue to catalyze this conversation about the critical importance of managing preterm birth and low birth weight, and in fact even preventing preterm birth and low birth weight. And also really doing more to establish the evidence about what works to manage early small babies and to push that evidence to the field so that our partners in low-resource countries are better equipped and better able to manage these babies so that, as you have said, they can survive and thrive.
And something else that I've taken away from this conversation is that most of these deaths are preventable.
That's right.
That it does not have to be the case.
That's exactly right, and that's a very important point. Thank you for that. So that's right. Most of these babies, the preterm birth or the vulnerable baby, they are dying from unnecessary causes. They are dying from, as you've said, largely preventable reasons. And so again, that whole care spectrum is so important in terms of how we manage these babies and ensure, again, that they're getting the care that they need. And a lot of it, as you pointed out, is very basic care. And they're getting that care immediately and over the long term.
Well, thank you so much, Judith. It was great to learn more about why we honor preterm birth today.
Yeah.
For people who want more information, where can they go to learn more about what you're doing?
So we have a gorgeous website, www.everypreemie.org, and you can find out a lot more about our project there and also see where we link to other partners globally and at the country level.
That's fantastic. Thank you so much.
Thank you.
And thank you for tuning in.